Hi, my name is Adam Power and I am Chief Medical Officer at Frontline Medical Technologies. The COBRA-OS Corner is meant to help you avoid some of the pitfalls that I've encountered as a vascular surgeon. Today we're going to talk about advancing the COBRA-OS through the arterial system and occluding the aorta in the right place. The COBRA-OS device has two external markers to help you with positioning and placement. There's a Zone 1 marker with a single black mark and a Zone 3 marker with 3 black marks. If you advance to the Zone 1 marker, you will be at 48 centimeters from the sheath, while the Zone 3 marker brings the balloon to 28 centimeters from the sheath. Zone 3 is between the renal arteries and the aortic bifurcation, and Zone 1 is between the left subclavian and the celiac artery. Just to make sure, it is recommended to check with external landmarks on your patient. Use the blue tab from the JTip straightener and the marker. If you line up the marker with the sheath, the blue tab should go to the xiphisternum for Zone 3 and to the sternal notch for Zone 1. When advancing the COBRA-OS, the JTip prevents aortic branch entry. However, if you do encounter resistance, pull the device back, twist it, and re-advance. This might help the JTip navigate the patient's anatomy. Well, I hope you've enjoyed this episode of the COBRA-OS Corner. Tune in next time for some tips and tricks about how to know when the COBRA-OS has adequately occluded the aorta during balloon activation.